Good morning. Thanks for being here, everyone. We are just seeing our attendees log in, so we will start in just about another minute. Thanks for being here. All right, we're going to get started in just about another minute or so. Thanks everyone for being here. Make sure you've got your coffee with you, or maybe it's an iced coffee this morning, and we'll get going shortly. All right, well, it looks like we might have everybody, or at least our first pass. Let's go ahead and get started. It's just after 8. Good morning and welcome to Eggheads, the Colorado Health Institute's monthly webinar series. Before we get started today, I just want you to know that this session is being recorded, and we will be pausing a couple of times during our presentation for some questions. So hold on to those questions, and we will look forward to having some conversation with you. I'm Sarah Schmidt. I'm the interim president and CEO of CHI. That is a new title, but I'm certainly not a new face here at CHI. I have been with the organization for 10 years, and it's exciting to see so many familiar names on the webinar with us today. I hope that most of you know a little bit about CHI, but for those of you who don't, we believe that good health policy leads to a healthier Colorado. We are an independent and nonprofit health research and consulting organization. And some of our work, like what we are talking about this morning, is for the public's benefit and is funded by philanthropic supporters. And we are grateful for the support that those foundations provide to us. We also consult with organizations, including community groups and providers and state and local government agencies, as well as foundations, to provide not just analysis and data, but strategic planning, facilitation, complex modeling, evaluation, and strategic communications. We are thrilled that so many of you have joined us this morning to learn about CHI's newest resource, the Colorado Counties Health and Climate Index. And the timing for this conversation feels right, as here in Colorado, across the United States, and in countries all over the world, including in Europe right now, are breaking records for high temperatures this summer. So very timely conversation. Before we dive in, I want to give you all a chance to get comfortable asking questions and putting things into the chat. So I want to hear from you. Yes, the heat can be very oppressive, but summer is also a great time for enjoyment, and especially we are very fortunate to live in a beautiful state to do that. So please go to the chat and tell me what your favorite summer activity is. Let's hear from a few people.
We seem to be having some technical difficulties on the chat, so if folks would instead put their responses in the Q&A.
Okay, Q&A it is. Thank you, Christy. And if someone on Team CHI is looking at the Q&A, please share some ideas. Tell us what people are doing this summer.
I'm seeing camping.
Nice.
Hiking with my dog. Oh, a star party. I want to learn more about a star party. That sounds fun.
Oh, it does sound fun.
Walking on the beach, jumping in the lake for a swim. Hiking is super popular.
Go figure.
Sarah, your people are here. We have cycling.
Thank you. Excellent.
Traveling, playing in the water. And gardening.
Very nice. Well, I hope everyone has time set aside this summer to do those things and more with people we care about. So the work we will be presenting today is part of CHI's Climate and Health Initiative, which is known as Acclimate. It is one of our 3 focus areas where we are committed to really dedicating our energy and our expertise. The others are integrating systems of care and behavioral health. If you want to learn more about those too, we will be dropping some links in the chat where you can find more information. And you can also watch previous Eggheads presentations on those topics, and we'll have some coming up in the future as well. We believe that we must address and make progress in all 3 areas now if we are to improve health for all Coloradans. We have no time to lose. So with that, let's get to it. I am pleased to introduce my colleague, Senior Policy Analyst Karim Ahmad.
Thanks, Sarah. And yeah, I noticed some other answers trickling in the chat. Concerts at Red Rocks, that's definitely my favorite thing to do. So good morning, everyone. Thanks for that level set and introduction, Sarah. My name is Karim Ahmad, and with my colleague, Chrissy Esposito, we've worked on CHI's climate and health portfolio for the better part of the last half-decade, really, making sense of the connection of climate's impact on the health of Coloradans through creating indices, through creating data resources, giving dozens of presentations to community groups, convening different types of stakeholders, policymakers, and working with public health professionals. So also joining me on this call and really leading a lot of this walkthrough of our climate and health index is Chrissy. Chrissy, would you like to quickly introduce yourself?
Wow, thanks, Karim. Good morning, everyone. So my name is Chrissy Esposito. I'm a policy analyst at CHI, and I lead a lot of our research and analysis for our climate change portfolio.
And I also just want to give a shout out on this call behind the scenes are Jackie Zubricky, she's our communications manager, and Lindsay Whittington. She is a policy analyst, and the 2 of them really contribute. So Jackie is one of the co-authors on this climate and health report and helped lead a lot of our thinking on this report. And Lindsay was one of the big brains behind the data and mapping tools. Yeah, good morning, Lindsay, in creating this tool as well. So today we're here to sort of quickly share some updates, one on our Acclimate initiative, our Acclimate Colorado initiative. Chrissy is going to be sharing an interactive overview of our climate and health index, along with some key findings from our accompanying report, which we will link in the chat. And then we will hold time at the end for a Q&A and sort of discussion for you all. As a reminder, if you have questions, feel free to use the Q&A feature. And if you'd like to speak up, please use the hand raising feature and we will call on you during the Q&A session. For those of you that didn't attend our webinar in April, where we first debuted our Acclimate Colorado initiative, we'd love to share a little more about this initiative. So really, the vision for Acclimate Colorado is it's a Colorado where communities are prepared to meet the urgent health challenges that are caused by a changing climate. And the key objectives of this initiative and of sort of all parts of this initiative include really elevating the adaptation and resilience conversation. We acknowledge the importance of reducing greenhouse gas emissions and while at the same time thinking about how we protect human health and how we ensure that we're creating policies and programs that ensure the well-being of all Coloradans. 2, a key objective is to really inform local and state level decision-making on climate change adaptation. 3, we're really thinking through sort of how do we think about providing evidence-based policy interventions, ones that are either evidence-based or promising practices in this field. We recognize that the field is in many ways nascent, and new ideas are coming out every day. And we're also looking to bring together folks who are already doing this work, and we want to complement other efforts. So this slide really gives an overview of our Acclimate Colorado initiative work. This first research component, of course, it's always ongoing, and today's focus is on our recently launched index tool that Chrissy's going to walk through. It really drives a lot of our background research, and we've also been in sort of the process of direct engagement with community leaders, with climate leaders, and public health leaders that are driving climate initiatives over the last few months that are going to help us inform this work moving forward. Next week, we launch what we're calling the Acclimate Action Team. You'll see that bolded under the engagement icon, who are made up of leaders from advocacy, environmental justice, rural public health, metro public health representation, academics, some of the big minds on climate and health in Colorado. We're also bringing together folks that represent Indigenous and Native groups, state level, people from health department and resilience office, as well as researchers and groups that are working in energy and economics. So really a comprehensive group of people that will be directly advising and collaborating with us on a policy agenda that we look to have done going into 2023 that will include sort of key focus areas for Colorado to focus on to protect people's health from climate impacts. It'll include a community engagement strategy, a focus on health equity, and really short and long-term strategies that can be used to drive adaptation planning now and in the coming future. So I'm going to pass it on to Chrissy, who's going to jump into our updates on our new climate and health index.
Great, thank you, Karim, and good morning again, everyone. So I will be giving you a brief background on how we got here. So as Karim said, we've been in this space for a little bit over half a decade. And we really jumped in the beginning with the release of our first climate report that laid the foundation between climate change and health in Colorado. And then in 2019, we released the state's first health and climate index that looked at climate vulnerability at a regional level. Now, using both of those reports, our experience in the field, as well as expertise and input from other stakeholders and experts in Colorado, we created a new and more comprehensive version of the index that includes 32 metrics across 4 categories. And I'll go over those 4 categories now. So the first one, exposure. Now, this is something that we probably think of automatically when we hear climate change. Exposure metrics are flood risk, fire, extreme heat, and drought. But we also have a category called health outcomes and access to healthcare. Now, this includes metrics such as chronic illnesses. And chronic illnesses such as diabetes, cardiovascular disease, and asthma can be exacerbated when we have extreme heat or poor air quality days. And in this category, we also have metrics about being uninsured or having access to healthcare when you need it. Because having insurance coverage and a place to go when you have a medical emergency, such as an asthma attack, is important in our day and age. Moving on to social factors. This is our biggest category. And a lot of these metrics are including things like age and language and education and income. Now, all these metrics have been linked to climate vulnerability, are evidence-based and in the literature. And in our last section, we have plans and perceptions. So we have a category filled with what are different types of climate action plans, county wildfire protection plans, does the county have hazard mitigation plans, as well as what do people in the county think about climate change? Do they think that it is happening? Do they think it's going to harm them personally or harm future generations? Now, using these 4 categories, we did a statewide analysis, and our 3 takeaways for you today are: the first is that climate change is affecting Coloradans' health in a myriad of ways, but a lot of it depends on where you live around the state. It depends on your health status. Do you have any chronic diseases present? And a lot of social factors. How old are you? What is your income? What is your education? Do you have any cognitive or physical difficulties? Things like that. The next is that we found that in many areas where we saw the highest risk for climate exposure or health outcomes or social factors, those counties tended to be the least prepared for the health impacts of climate change. And lastly, I want to highlight that this is a tool for you. This is a tool for stakeholders and community members and policymakers to really try to assess risks and strengths so you can plan accordingly when it comes to adaptation and resiliency from climate change. A little about our data. Something we want to note is that this is a snapshot. It is not a prediction. We are showing you a point in time. We are not telling you when and how climate change is going to be 5 to 10, 20 years down the road. The next is that not all metrics are available at the county level. So you might notice that there are some metrics missing, such as air quality, that we would have loved to have included in this index, but it's not available in every county because not every county has an air quality monitor. And lastly, this is a big one, and it's that vulnerability can vary within county lines. As many of us know, Colorado's counties are pretty large, especially as someone who came from the East Coast. And in Colorado, I'll use my county of Jefferson County for an example. It's very big. And so when I live in the Lakewood Littleton area, I might see a lot of 90 degree to 100 degree days like this week. But my counterparts up in Evergreen might not be experiencing that. They might be facing more wildfire risk. So when we think about this index, while it is at the county level, it's very important to note that a lot of strength in planning needs to come at the local level in cities and towns and villages and tribes. So let's talk about how to use the index. So there are 3 components for you. The first is you can start with the report. It provides a statewide analysis that examines state trends. In there, you can find guiding questions under each of those 4 categories that I just outlined that can really help you and your community plan for the health impacts of a changing climate. And if you're really interested, we also have some promising practices dotted throughout the report. And Cara is going to jump back in soon in this discussion and highlight a few that we think are pretty interesting. And if you read the report and you're like, great, I see the statewide trends, what's going on in my county? Well, we have 64 county profiles, and my colleague Lindsay is going to throw this into the chat so you can explore how your county is doing. Within each of these 64 profiles, we highlight what is your overall risk score for each of those 4 categories, and then we give you data on all 32 metrics of the index. So in addition to showing how your county is doing, we also compare it to a regional average. And if you're really interested in knowing, like, okay, I know the statewide trends, I know how my county is doing, what about some counties in my region? Well, we have an interactive map, and we're actually about to explore that a little bit more in depth in just a moment to talk about some geographic findings. But you can use this mapping tool, which Lindsay will also throw into the chat in just a moment, to really examine more metrics within your county, your region, and also just look at how your county is doing compared to others across the state. So for our geographic findings, as I said, we're actually going to transition over to the interactive map and have more of an interactive session to kind of tell you what's been going on within each of these 4 categories. So I'm going to have Lindsay throw in the map link. You can either follow along with me on the screen that I'm about to share, or you can kind of play around with the map as I kind of tell you some of our big findings in each of the categories. So we are going to hang tight while we switch screens here. All right, and then just a confirmation in the chat from anyone that we can see the correct screen. Great. All right. So when you get that map link, it's going to take you to this web page. Now, this will give you a little bit more about the index. If you haven't had a chance to read the report, we'll give you a brief overview. And if you're interested in knowing more about the data and resources we used, you can click on this link here and I'll shift you right to the bottom and tell you about all 32 metrics. But we are more interested in the mapping component. at this time. All right. So if you have that map up on your screen, it should look something like this. And what I like to do, and this is just a personal preference, is making sure folks can still see my screen too, if that's still working. Great, okay. Screen switching is still hard for me 2 years into the pandemic. So what you can do is that there's this little tab up here. It says open live content into a new tab. I always like to hit that because it opens the map up to be a little bit bigger on your screen, but you can do it either way. So like I said, we wanted to kind of walk you through in a more interactive format about these findings. And so you can find all 4 of the categories on the upper left-hand side of your screen. And we're going to start with exposure. Now, for all the maps that we show you, the darkest color orange means the highest risk, and the darkest color blue means the lowest risk for each category, because all of the categories we have were split up into 4 quadrants. Now, here we're looking at exposure. And as you can see on your screen, in the darkest orange category, we are seeing the western slope really highlight here. And the reason we are seeing that is wildfire risk and drought. So most counties in these darkest orange color spent the entire year of 2021 with some portion of their population living in severe to extreme drought conditions. You know, in the Front Range in 2021, we saw a lot of rain and moisture, but that wasn't being felt on the western slope. And we also know that in these western slope in these dark orange counties, that almost all of them have at least 75% of their population living in a wildland urban interface. Now, for folks who've never heard that term before, that's when there's community buildings, residences, and commercial buildings that are intermingling with wildland fuels. So something that can catch fire very quickly. Now, if you're interested in knowing, okay, well, I really want to see how that drought is distributed across the state, you can unclick this exposure metric, and you can go down to severe to exceptional drought. And again, the colors are a little different, but darkest orange always indicates highest risk, and darker blue always indicates lowest risk. As we can see, when we hit severe to exceptional drought, counties on the western slope are really highlighting with that. And if you're like, well, I live in Eagle County, what was their drought risk? You can just click on it. And so 98% of weeks in Eagle County had some portion of the population living in extreme or exceptional drought in 2021. So that is exposure. Feel free, if folks are following along on their own computer, to kind of play around with the other metrics. I'm going to be moving on to health factors. Now, reminder, the health factors includes chronic illnesses and access to health care. So clicking down and just looking at the legend again, darkest orange, highest risk, darkest blue, lowest risk. We can see that Southeast Colorado really highlights here again in the highest risk category. And the reasons we're seeing this, this section of the state really pop up is they tend to have the highest prevalence of obesity, chronic obstructive pulmonary disease, also referred to as COPD, and depression. And so if you're interested in seeing, okay, well, I'm very interested in knowing what the depression looks like across the state. We just click on this and we can really see how it highlights down in Southeast Colorado. Now, I won't be going through each of the major contributing factors to these highest scores, but I'll be giving you a few examples for each of these categories. And so moving on to social factors. So as I mentioned earlier, this is our biggest section, and it does include factors such as age and income and education and language and cognitive and physical difficulties. And again, all of those are evidence-based to be connected to climate vulnerability. And when we look at the map right here, looking at our overall risk, we're seeing Southern Colorado and Southeast Colorado really highlight with some of the highest risk. And the reasons that we're seeing these counties in that category, a lot of it has to do with they have some of the highest rates of poverty in the state. We also saw that they have some of the oldest homes. And you might be wondering, how do old homes really factor in the climate vulnerability? And well, for those of us who have a home, when it's very hot out or when there's poor air quality, our house is where we seek shelter. And so an older home is less likely to have insulation or been upkept with maintenance. And those are very important things when it comes to air quality and heat, and even in the cold for extreme cold days. And we also saw in this region very high rates of people who speak another language, which is important when trying to access healthcare or being alerted when there is an adverse weather event in your area. So just moving on, if we're very interested in seeing the older homes, we can see that it's a lot on the eastern plains in southern Colorado, where homes were built before 1980 and less likely to have the insulation or cooling systems and been upkept with maintenance. So moving on to our last category, so plans and perceptions. All right, so here is our last one, and I'm going to say it just one last time, just in case anyone didn't hear me the first 3 times. Darkest orange is highest risk, darkest blue is the lowest risk. And plans and perceptions, there are a lot of perception questions, such as, do you believe that global warming is happening? Will it harm you personally? Will it harm future generations? But we also have a whole category of plans and commitments. Now, in the Eastern Plains, which is highlighting up on your screen as some of the highest risk categories, and also in Northwest Colorado, very few counties have more than 1 or 2 plans to assess climate change, disaster risk, wildfire mitigation, and planning. And so they scored a lower because of that. And also counties in this highest risk category in the dark orange also scored the lowest on all of those perception questions that you can see up on your screen. So just showing folks one of these right here. As we can see for the plans and commitments, and I probably should have mentioned this earlier, if you just click these little arrows here, it shows you the legend. You can see that in the darkest orange color, these counties only had a few of the set of plans and commitments that we found for climate change and health. So I'm going to pause, and while I'm transitioning to get our slides back up, we're going to be opening it up to questions. And these can be questions about this map, they can be questions about the county profiles, the report, anything that we have talked about on the index. We always want to give folks some space before we move on to the rest of our discussion to see if anyone had any comments, questions about this.
So we actually already have one question that I want to flag, and it's from Paul Aldretti. Good morning, Paul. Is it possible to layer factors across indices? For example, can you look at exposure and health factors?
At this time, no. But I'm interested in knowing, Paul, and from others, if that would be a helpful tool. Because if so, we could put all the layers onto one map in the future, or just have an option for that. Because right now they're just all separated out, just to make it a little bit easier on the user end.
We're seeing some comments in the chat that it would be helpful to layer it in that way. Another question that came in through the chat is, how often do you plan to update the data for the index?
That's a great question. Carm, do you have any thoughts on that?
Yeah, I can. So the last iteration, this is the second iteration of the Climate and Health Index. The last time we put this together was in 2019. We will likely, so the way that we look at the data is the data that we put together is as up to date as possible. We're looking at potentially updating it annually, but some of the data factors, especially I would say the social factors and some of the health factors, actually do not change that much over time. But to answer your question, we do look forward to updating it potentially annually or every 2 years, which is where we see some change.
Anything else?
I have another question that just came in, and it's, where do capacity factors such as access to healthcare availability show up in this?
So that's a great question. As of right now, we only have 2 healthcare factors in that second category of health outcomes and access to care. And those metrics are insurance coverage and did someone not seek care in the past 12 months that needed it, or they weren't able to get care in the past 12 months when they needed it. And so at this time, we don't have that any other metrics included in the index, but I'm curious if folks are interested in seeing similar healthcare capacity metrics in a future version of this index.
And those metrics show up in the health factors
Yes.
map. So if you want to toggle through and look those up, you'll be able to see those. Question that's come through the chat is, do you have any plans to make some projections? For instance, if we make no change to the Colorado River water management and what that might mean, or if we have wildfires year round, excuse me. I can answer this question. So like at this point, we don't plan to put together projections. There are climate scientists at the University of Colorado Boulder and nationally that do that full time and do a great job of it. And we're happy to connect you to resources that already do make those projections, especially on water, wildfires, those sorts of things. So no, we don't plan to make any projections. Our focus is really on sort of the intersection of health and climate, but we're happy to connect you to resources if that would be helpful. There are resources out there that are already making projections. So we wouldn't want to duplicate work.
Anything else before I hand it back over to Karam?
And if folks think of other questions that come up, we're going to have an opportunity after I roll through the next couple slides. I'm just going to share a couple examples of some policies and programs that are in action and that are showcased in our report. If folks have questions that pop up or come to mind, feel free to still use the Q&A feature. I'm seeing another question actually just came in. And I'd be happy to facilitate and answer, and we can answer those questions later on. No, we can answer that question. So how about adding anything about vulnerable populations related to poverty level? Oh, yep, exactly. Yeah, we do it. We have all of those indices in, or all of those indicators in the index.
Yeah.
So another question just came in. It's which counties are most at risk from a direct health outcome impact based on your analysis? Do you have a link to counties with high number of heat-related deaths?
We don't have that, but CDPHE does have, well, not deaths, they have heat-related illness and heat-related emergency department visits. And I'm assuming someone from CDPHE could pass along information on heat-related deaths since they keep track of that.
Awesome. Well, if folks have questions, please direct them either in the Q&A or in the chat, and we'll be happy to answer them. I'm gonna move forward to the next two slides just so we can share a couple of examples of policies and programs that are happening and that we showcased in our index report. And if you have questions, again, we'll have another opportunity to answer them in just a couple minutes. So a program that we like to highlight that's happening in the Metro Denver area is the Love My Air Denver program. So concerns about the impact of poor air quality and the impacts that it has on children's health led the Denver Department of Public Health and Environment, and in collaboration with Denver Public Schools, to create this Love My Air Denver program. What it is essentially a network of air quality monitors at schools that track air quality in real time, giving sort of empowering teachers and their students to be able to track a climate exposure that can impact their health, and allowing them to make decisions to support students' health. That's really at the heart of this. We really spotlight this because teachers, they can also use the monitors as a climate change learning opportunity for students. I was actually on a climate change and health conference yesterday, an online conference yesterday, and one of the most common, one of the top groups that top groups of professions that are known to be trusted in general are teachers. So teachers sort of serving in that capacity of teaching future generations about the connection between climate and health and using this air quality monitor program as a teaching tool is really a great opportunity. There's actually a toolkit that the Love My Air Denver program has that they've put out there. It's a replication toolkit that provides resources for other municipalities and cities that are interested in creating similar programs. So we're happy to provide a link to that resource, but we really want to spotlight this as an example of a climate exposure with poor air that we know happens a lot. I think Denver is 10th or 11th worst in the country for poor air, and an example of a community, so young children and especially children with asthma in the Denver area, and an action to protect their health. So my hometown of Fort Collins is actually, it's the 9th fastest warming city in America, which like baffles me when I learn that. And in anticipation for more days where high heat can threaten people's health, the city of Fort Collins is thinking through and introducing an extreme heat plan that's going to initially start with sort of expanded community messaging, making sure people know when. I mean, heat is something that we can predict. That is a climate factor that we can predict, and because we can do that, you can prevent illness and death through community messaging, through providing resources, through keeping people cool. And the city of Fort Collins is specifically focusing on expanding resources for people who are experiencing homelessness, for where they can go when temperatures rise. I think a week ago, we breached over 100 degrees in Fort Collins. And what they're looking to do is make use of already existing shelters and resources where people have historically been going to keep warm during periods of extreme cold. And the city will be building this plan out over time to include resources and partnerships to help prepare folks in the community in Fort Collins for hotter summer conditions. So this is an example of the climate exposure of extreme heat and the disproportionately impacted community of unhoused populations or persons experiencing homelessness, with sort of a practical solution of making use of already existing infrastructure, coupled with clear and just clear health communications messaging, so people know what to do when it's hot out to protect their own health. So that's the end of sort of the content of our presentation. We've got 20 minutes, and we'd love to sort of, now that we've shared a bit about how you can use the index and some examples of real climate adaptation policies and programs. By the way, there are about a dozen more in the report if you'd like to see some of those promising practices. But we'd love to hear from you. So, you know, does your community have a plan to protect your community from climate impacts? How can CHI support you? Is the work that we're doing now in our state, in our communities, in our cities, in our neighborhoods, is it enough to advance equity? And we can actually scroll through all of these questions. I'd love to just have them up on the screen for people to think through. You know, and how are folks sort of framing climate change and health in their work and in the messaging that they're using when they work with their communities? And then again, as a reminder, please feel free to use either the chat or the Q&A feature. And if you'd like, we can call on you if you'd like to verbally answer or ask a question. So I will pause and allow those questions to come in. I would also like to provide the opportunity to ask for other people to ask questions specific to the index and the data as well. We have a comment in from Jana, and she says, I'm glad you're doing this work. It would be super helpful if you could show possible future scenarios so there could be more long-term thinking planning. Yeah, I think there's an opportunity. So there are reports out there that that do future scenario planning, future scenario outcomes for different climate exposures. And I think connecting what we know now and connecting it with what we potentially can happen in the future, and connecting that to what we would project for sort of the demographic makeup of the population and the health makeup of the population, I think certainly is a great area for us to explore in the future. So thank you for flagging that. We have a chat from Stacy. She says, in Massachusetts, we are working on, hello from Massachusetts. We're working to expand resources focused on extreme heat to add to their work. And she put a link in from, so this is from the Health Resources in Action organization out of Massachusetts. She said, do you have model policies, practices, and resources for a school audience for extreme heat? I'd like to open that to the rest of the CHI team. I'm not thinking of one off the top of my head, but and I'd also invite others who are on this call if they are aware of toolkits or model policies and practices that are tailored towards youth school populations in extreme heat.
This is Jackie Zubricky. I will jump in here to say that I don't know that we at CHI have collected educational resources or like teaching tools for schools, and I'm not seeing them on here, but we have connected with some school nurses in Colorado who are doing a lot of thinking on kind of the practical ways that extreme heat or air quality show up and affect kids' health. And I'm searching, I don't, if you guys are on here, send me a chat. I don't think so, but I will pull up a piece that that these colleagues put together on ways that school nurses and schools can be thinking about climate and health impacts. And I am seeing some great resources also get shared in the chat. So yeah, I second Karam's call. If you are aware of resources for young people in schools focused on climate and health, please drop it in the chat and share. We'd love to learn more as well.
Thanks, Jackie. So another question that we had come in through the chats from Catherine Maloney. She says, do you have resources / roadmaps that can be shared with policymakers, local policymakers, to help move the needle on plans and perceptions? I'm happy to jump in on this question unless, Chrissy, do you have any comments on this?
Sorry, what was the question? Do we have any?
Yeah, so are there resources or roadmaps that can be shared with policymakers to move the needle on plans and perceptions, with the plans and perceptions indicators that we have?
So I think for, yeah, any local policymakers, when you have that county profile, it tells you exactly which plans and the types of views that people in your county have. So that could be a good start, is using that resource. And we also have more information on where we found those resources if people want to dig into that a little bit more.
Yeah, and especially on the perception piece, there's an entire body of academia related to climate change and health communication. The perception data is actually from the Yale School of public health, and we're happy to share some resources that are from them that are centered around how you frame climate change depending on the audience that you're talking to. So policymakers are mindful of the communities that they're working with. I'm happy to dig that up and send that to you, Catherine, if you wanted to provide your email. So another question that's come in is, did CHI look at the Health and Human Services request for the RFI on environmental justice, federal rather than Colorado specifically? Yeah, so we're aware. We know the Department of Health and Human Services has established that Office of Climate and Health Equity, and we know them as well as I think it was the EPA a few months ago put out RFIs to gather just any information on how climate resilience and climate adaptation strategies are manifesting in states. We'll have to dig into that. I'm not sure if I'm entirely familiar with the link that you shared, but Suzanne, thank you for sharing that. And Lindsay, thanks for sending the link to the Yale climate work. Catherine, that's where you can dig in to see some of the communications materials that they have.
If it's okay, this is Christy from CHI jumping in real quickly. I want to jump back to, I believe it was Stacy's question about resources for school-age children. And it took me a little while to find it, but in our April Eggheads presentation, we did talk a little bit about some work from the Virginia Department of Health, the Keep It Cool Kids campaign. And I will be, as soon as I get to that site, I will drop that in the chat, but that is one that we thought was a very good model.
Thanks, Christy. So I'm seeing two questions actually in the Q&A feature. One of them is, are counties and state using the same criteria for tracking heat-related deaths? And I would, Chrissy, I think you might know a little more on this. My take is that it's not necessarily the same.
I wouldn't guess that it's the same, but I would love if anyone's working at the county level or from the state level, if they would have an answer to that. Because that could vary from county to county.
Yeah, so if folks on the webinar have any insights on that, we invite you to share them in the chat. Another question we had come in is, would it be possible to add a resources page to your website to link people to information, sample policies? This could be updated more frequently than the index. Paul, that's a great idea. I think internally we have so many resources and research, mapping tools, frameworks, toolkits that we're aware of that I think would be great to collate and share in an area that can be updated. So that's certainly an idea that we should consider moving forward. And thank you, Christy, for sharing she dropped the link to the Virginia heat-related Keep It Cool Kids program for folks to check out. Seeing a couple more comments in the chat. From Stacy, she's saying less for children, more for stakeholders. This is great too. We're focused on wellness folks, administrators, nurses, those that can promote policies and practices. So diving more into sort of the how to do better communication with the policymakers. Thanks for sharing that. And Jana put a comment on, I'm very interested to hear what messages work best. I can tell you, like in the literature, the first and foremost thing that people care most about is their own personal health and the health of the people that they care about. In the field of climate change communications, the most compelling way to frame messaging is around health, actually. There's been research to look at, is a sort of defense, looking at a military perspective, a homeland security perspective, is an economic perspective the best way to frame it. The most compelling way to get people to, and this is in the literature, to get people to believe in climate change, to act on climate change, and to actually sort of put forth action on climate change is to use a health framing. So talking about the exposures and talking about how it impacts people's health directly, having those conversations and creating those convenings where you're centering the conversation around health is definitely one of the best ways of doing that, if not the best. And then we have a question from Borum. He says, where does Colorado rank nationally in terms of climate health linked risk? So it's kind of difficult to answer that question. I don't know if there's a national ranking of sort of like a state by state climate health risk tool. So it's kind of hard to answer that question. I would say the way to think about climate and health related risks is it's really at the sort of local level. If you're in Louisiana, for example, the climate exposures and climate risks, as well as sort of the demographic makeup of states, is going to be very different depending on where you are, whether you're coastal, whether you're in the Midwest. So it's hard to say where Colorado sort of fares, because you'd have to factor in so many different things, and it's kind of a state by state approach to thinking about that. Chrissy, do you have anything else to add to that?
No, you did wonderfully, Karam.
Yeah, and I'll just chime in that I think that would be, this is Jackie again, I think that would be a really interesting thing to see, just a little bit outside of the scope of this project. And we didn't actually, we didn't rank counties even for this project within Colorado. But I think that, we will keep our eyes out for that in case someone is starting to look at that on a national level. And I think just one thing we can say is that for like across all counties, a lot of these risks are, have been growing over time. And so things that like extreme heat that we hadn't thought of as issues in Colorado as much are becoming more common. So yeah, great question. And just a little outside of the scope of this project.
Thanks, Jackie. So we're coming close up to time. I'm happy to take 1 or 2 more questions. I'm seeing one is from Heidi Fritz. She's saying, I'm just becoming familiar with your work in this area, so I'm not sure if this is included anywhere. And then she notes climate change and the intersection with transportation and land use policy that affects modes of transportation, agriculture and food systems policies, healthy eating, active living, and then in parentheses, HEAL for healthy eating, active living. We don't have transportation, agriculture, or food insecurity in this index tool specifically. We are aware of course, the intersection of those areas of work, and we're looking to, as I noted earlier, we're putting together sort of a comprehensive policy agenda that looks at, climate change is an issue that impacts everything essentially. So thinking about the impact on our food systems, thinking about the impact on agriculture and our agricultural workers, and sort of thinking about sort of the levers we can pull in terms of transportation are certainly top of mind for us. And I'm glad you're flagging that. Also the intersection, of course, with healthy eating, active living, and sort of taking a personal approach to your own health is something that we are considering. And then I'm seeing, Paul, thank you for sharing that resource for Jana's question. The last question that I'm seeing from Janice, can you provide resources from the chat afterwards? Yeah, we will save, so we'll make sure to save this chat and collate the links and resources that were shared here. And we're happy to share them with the folks that attended today. But I thank you all for the questions and the super engaging chat and questions you guys provided today. As always, we're always happy to follow up after this conversation. This is just the start of launching our index and launching many conversations moving forward. If we could put my email in the chat, actually, my email and Chrissy's email in the chat, if folks have questions regarding the index specifically, or if they have questions regarding CHI's climate and health work in general, feel free to reach out to us. We're always super excited to hear from you and work with you and collaborate. This is work that requires collaboration, cross-sector collaboration, and cross-state collaboration. It's really cool to see people outside of Colorado on this call today. So we're excited to continue the conversation and thinking in this important work. And stay cool out there, folks.